Good afternoon, everyone. This week, we saw COVID continue to spiral out of control in both Ontario and Grey Bruce. Ontario reported 16,390 new cases in the last 7 days, while Grey Bruce had 51, up from just 8 2 weeks ago. There are currently 68 active cases in Grey Bruce, with the health unit currently tracking 556 active high-risk contacts of these cases. 11 of the active cases are right here in the town of the Blue Mountains. Hospitalizations, patients in ICU and on ventilators in Ontario were up almost 50% over the last 2 weeks. Ontario's test positivity rate rose 48% in the same time period, from 3.22 2 weeks ago to 4.75% today. Currently, COVID-19 related ICU admissions are already over the peak of wave 2. COVID-19 related ICU admissions, which stood at 309 just 2 weeks ago, stand at 433 today and are projected to exceed 650 in a few weeks. Variants of concern now account for more than half of all COVID-19 cases in Ontario. These variants are more transmissible and result in a higher risk of death and hospitalization, including among younger populations. Today, on Thursday, April 1st, the provincial government announced that all of Ontario, including Grey Bruce, is moving to shutdown for at least 4 weeks, with implementation of a provincial emergency brake measures effective Saturday, April 3rd, 2021 at 12:01 a.m. The province-wide emergency brake puts in place key public health safety measures to help stop the rapid transmission of COVID-19. Measures include, but are not limited to, prohibiting all indoor organized public events and social gatherings to members of your own household. Limiting the capacity for outdoor organized public events or social gatherings to a 5-person maximum, except for gatherings with members of the same household, that is, the people you live with. If you live alone, you are permitted to join one other household. Restrictions are also being placed on in-person shopping in all retail settings, with a 50% capacity limit for supermarkets, grocery stores, convenience stores, indoor farmers markets, and other stores that primarily sell food, as well as pharmacies. There is a 25% capacity limit for all other retail. Prohibitions are also being placed on personal care services, indoor and outdoor dining. Restaurants are limited to takeout, drive-through, and delivery only. Prohibitions are also in place for facilities for indoor and outdoor sport and recreational fitness, day camps, and there is limited capacity for weddings, funerals, and religious services, rites, or ceremonies. On the advice of the Chief Medical Officer of Health, all Ontarians are also asked to limit trips outside their home to necessities such as food, medication, medical appointments, supporting vulnerable community members, or exercising outdoors with members of their own household. Employers in all industries are asked to make every effort to allow employees to work from home. During the emergency shutdown, schools will remain open for in-person learning with strict safety measures in place. The spring break will continue as planned for the week of April 12th. In order to support working families, childcare will remain open during the shutdown. Childcare settings will continue to adhere to stringent health and safety measures so that they remain safe places for children and staff. Moving to a shutdown will assist our efforts to limit the transmission of COVID-19, said Grey Bruce Medical Officer of Health, Dr. Ian Ara. In particular, the shutdown helps to address concerns that we have with bars and recreational classes that have been a source of infection. The health unit advice to stay safe and reduce transmission of COVID remains the same. Wash your hands frequently, watch your distance, ideally 2 meters, wear your face covering correctly, avoid crowds, and arrange for outdoor activities instead of indoors wherever possible. Most importantly, with the amount of the highly transmissible COVID-19 variants circulating, it is important that you get vaccinated as soon as you are eligible. Currently, appointments are being booked for residents turning 75 years old or older this year. That is, those born in 1946 or earlier. If an appointment has not already been arranged for you by your health care provider, you should not wait for them to call you and book yourself an appointment through the provincial online booking system for COVID-19 vaccinations at ontario.ca book vaccine. Those without access to the internet can call the toll-free number 1-888-999-6488. The booking system will direct you to the closest available clinic with capacity. The health unit is adding new clinics each week, and these are uploaded into the provincial booking system. A list of clinics in Grey Bruce can be found on the health unit website. I am aware there have been problems with the provincial booking system, but the health unit is working to resolve them. If you encounter problems and need help registering, help is available locally by calling either the Seniors Without Walls program at the Beaver Valley Outreach, the Blue Mountains Public Library, or the Thornbury PharmaSave. The Blue Mountains Public Library has found that many residents do not have access to print their registration document. If this is the case for you or someone you are assisting with their vaccination registration, the email you receive with your registration document may be forwarded to the library info at thebluemountains.ca, and they will print it for you and meet you at their curbside to pick up your form free of charge. Pharmacies, including our own Thornbury PharmaSave, are also booking appointments for AstraZeneca COVID-19 vaccines for eligible people aged 55 or older in 2021. To book your appointment, phone the pharmacy or visit the pharmacy booking website. Have a great weekend and stay safe.